Now somebody is looking. You wanted to show us how you can do flexion extension? We know how to do it. But I know the trick point, sometimes the patient they will do and you want to put attention on. First, we'll start by upper cervical spine. What is the movement of upper cervical spine? No. No, think it's okay, but what is the most movement that you can see? Flexion, we call it flexion extension. Yeah, if you mean that, like that? Nothing? Okay, what do you think about contraction and retraction? The movement that will come from the upper cervical spine is contraction and retraction. And remember, most of our patients, when they come to the clinic, they won't sit like this guy. Usually they sit like that. Most of our patients like that. All of them, and this is a postural problem. But if he just shift his back up, everything will just get better. If you do many times mobilization, many times manipulation, and the guy is still sitting like that, just you are wasting your time. So how we can test this movement? Actively, I will ask the patient first to straighten up their backs. Don't ask the patient to test him from slouch. This we call slouch of the head. حتى أنا بقول لك كلكم الجالسين واحد في هذا البوستشر. خلي أي واحد منكم يبغى يفتح فمه، افتح فمك جرب. هتحسس في ليميتيشن ولا لا؟ ما فيها خجل، افتح فمك. خليك كونتراكشن، خذ راسك كونتراكشن، حاول تفتح فمك. هتلاقي نفسك انك في ريستريكشن، حتى التي ام جي بيكون في ريستريكشن. لو انت بهذا الوضع، خلي البيشنت حتى هذا اللي تستخدم مع ناس اللي عندهم مثلا في وانا any patient who has a shoulder problem, to go for full flexion. If slouch, go for full flexion. Go for as much as you can. Okay. And if I ask you to straight up, you can go for further movement. But remember that you want to move this back. Okay, guys? The movement, I will ask the patient to straight up, their back. Then after asking, try to do chin in. So, begin to then I will ask, do you feel any pain? He said, no, this is clear. Then I will ask him, take your chin, this chin out, and this is chin in. Take your chin in. Then this mobility is just focused on the upper cervical spine. And remember, most of the patients who have cervical headache, they will feel pain during this movement. Most of them, not all of them, but most of them, they will feel pain or limitation or discomfort at least. Okay guys, this is how we can do it actively. Then we'll show you how to do it passive later. This is, we know now how to do contraction and retraction. First, we should straight up your back, chin out, and ask the patient, do you feel any pain? Anything that make the same thing, the same complaint that you come because of it? Then I will do chin in, you see, and you will ask this, do you feel any pain, discomfort? Then you would know, before you go even for the lower cervical spine. Then I will ask him to go for flexion, and usually we do flexion all the time, straight up. Put راسك لأسفل as much as you can. Then go for extension. Okay, as much as you can. Okay. Just think about if the patient is slouching, خذ extension. The most movement, it won't come from the lower cervical spine. It will come from the upper cervical spine if he is slouching. Then I will ask him to straight up, go for extension. Okay. Then I will ask him to go for right rotation. You see how he's doing it? شايفين كيف سوى right rotation مع سكين. And he's still, physical. Then I will ask him to straight up again and try to direct the movement. Lift راسك, go as much as you can. The other side. And remember, most of our patients when they come to us, خاصة الناس الكبار, يقول له لف راسك سوى كده، لف راسك يحرك الكتاف معك. Most of the patients, the movement will come from where? From the thoracic spine, isn't it from his neck? Then I will ask him to go for side bending, straight up again, side bending to the side, and he's still doing rotation. But remember that side bending and rotation is a coupled movement. It means that the orientation of the cervical spine, the orientation, معناته كيف شكل cervical spine جاي 45 درجة زي كده. Then expect when you go for rotation, you go for rotation and side bending. It's a coupled movement. Side bending and rotation is a coupled movement. If you go for side bending, still there is some rotation. If you go for rotation, still there is some side bending also. Okay guys? Then you rotate to the other side, then you go for side bending. And remember, some of the patients, if you do this one, you will shift this way. Ask him. Try to touch by your shoulder. Okay? Then you will go for the other side. Okay, this is the active. And we should mark. Usually when we mark this one, في ورقة محتاج بعدين بول بعدين بول بس أعطيني دفتر ولا شيء شو بس خلاص خلاص. You will see all you guys. I will mark it here and it's easy for you to see. Usually we use the movement diagram. The movement diagram على شكل المنجلة كده. يكون خط زي كده على شكل المنجلة. شايفينه كلكم يا شباب؟ على شكل المنجلة شايفينه؟ كلير واضح؟ في العادة ما هناخد الفوليوميتر فليكشن 15 20 25 اكستنشن 30 we'll break it down to 4 quarter. 1 quarter, half, 3/4, then full range. Okay guys? If this guy comes to me and he told go for flexion, and he's stuck, you know, here. And he said there is a pain. حبة دايما من السنتر. سوري حبة دايما من السنتر. من السنتر حبة من هنا من السنتر. الحين هو سوى له ربع. just to part. هسوي مارك هنا. لو مشى على نص الرينج هحط مارك في النص. لو هو مشى على 3/4 هحط المارك على فوق. لو كان في الرينج حط عليه كليك صح. ايزي. الاكستنشن نفس الشيء. في البدايه يدوب حرك راسه على ورا كده قلم احطه هنا على بدايه الربع. لو كان على النص احطه كده على النهايه هنا. لو كان قريب نفس الشيء. سايد بندنج حبدا من النص. هذا رايت هذا ليفت. فجو تو ذا رايت ذس واي ستك في البدايه حيكون نفس الشيء. هنا الهاف 3/4 فول رينج. ماشي؟ الروتيشن نفس الشيء. الروتيشن حبدا من هنا. لو انا لفيت على اليمين يا دوب ممكن اكون في البدايه النص 3/4 اول كلين. واضح يا شباب؟ This is the way we are doing, you know, the range of motion in manual therapy. Then we'll go for the passive. And the passive, we should focus. If you come for the flexion, we should support, ask the patient to straight up and support the first, you know, the chest. Why? Because some of the patients, when they start to do it, they will lean from their back. Then I know I'm supporting the whole spine. Then I will take his leg down, 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 and ask about signs and symptoms. Okay, guys? Then I'll go for extension from the back. I will support also the upper thoracic. Then I will take it for extension this way. Then I'll go for side bending. I will support this area, 2 side bending to the back. Because some of the patients, they will shift. Okay? Then I'll go for this area. And also for rotation, remember for rotation, some of the patients, they will start to rotate this way and they will move. Then I should block the shoulder. What I will do, I will block the shoulder, holding this area, and the other hand will be here. Now, if I would like to rotate to this side, he will rotate like that. If I don't block, maybe he will move with me. But here, I'm blocking his shoulder. He can't move his shoulder. I will block the movement, take him for rotation. I will go for the other side, block this area, and I will go like that. Then I know I take clear, active, and passive range of motion. For the upper cervical spine, we'll do the same. I will ask the patient to straight up first. Then what I will do, for protraction, I will put my hand underneath the mandible, and this one will be in his skull. Then I will just push to the anterior side. I will just pull. Okay, guys? Pull, doing this movement. And I can do over stress if I need. For retraction, my hand will be like a U shape under his mandible. You see? Then I will push and pull from the skull. Push like that and pull from my skull for retraction. Okay, guys? It will be like that, underneath the mandible. This one will push in and that will pull out. This one will push in, this one will pull out. And usually when you test a patient, try to take him close to your body. I will ask him to come here, back. This is easy for me to just move. Okay guys, الحين عرفنا كيف نسوي الاكتف الباسيف. We do need to practice. We practice later. Then, before I start for palpation, I will clear out if there is any problem with the upper cervical spine. If this patient I should continue or just I will stop. Then I will do special test, and the special test for upper cervical stability, we've got sharp bursar test, we've got other ligament test, and we've got BBI test. This thing we should clear out before we start. If the guy come to you and he told me there's a nausea, there's a vomiting, maybe psychologically can pull a pain from this area and come out. If I do retraction or traction, it will increase. Then I'll do sharp bursar test. خلينا في السفر شوي عشان أنا طويل ما شاء الله. For sharp bursar test, first I should straight up the back, and I will go for palpation for C2. عرفنا إنه C1 there is no spinous process زي ما أنتم شايفين. Here, sorry, from this side there is no spinous process. The first spinous process will find C2. Then I will go for palpation for C2. And عارفين إن الأرا ligament will start to from the dens of C2 and stuck in the base of the skull. Then I need to fix C2, then I will rotate to right hand side, to the right and the left. Okay, then what I will do, ترى اللي يبغى يجي هنا يبغى يشوف عادي. ولا لفه كده؟ كده كويس ولا بالعكس؟ Okay. What I will do, I will ask the patient to straight up. If this guy you see him, he has contracted leg normally, even though he is straight up. ليش يشوفوا اللاين في انه هذا اللي هو الاير هول هو جاي على الشولدر. شايفين؟ في مسافه. But if you do retraction, now this is the normal pose. In his case, he has contracted leg. I will ask the patient to straight up first, then I will ask him to go for flexion. If you go for flexion a little bit, like if you go for retraction, and a little bit of flexion, all the spinous process will come out and it's easy for him to observe. Ask him to do retraction, a little bit, and flexion. Then gently, this is the foramen magnum, all of us know. If I go down and rotate, then I will find C2. Say the first spinous process C2. Then what I will make a grip like that. You see? A grip like that. Why a grip like that? Because I would like to just make a fit grasping for C2. And sometimes they say, yes, there is muscles. I know there is muscles. This is the grip. Then maybe you can just fix C2. What I will do, this is C2. I will grip C2 very firm. Okay? This is C2. You see, if I go for C2 here, I could move this leg, you see? See, guys? What I will do, I will make a form. If I would like to test the ulnar ligament in the right side, I should rotate to the left side. What I will do, I will make a fit grip, then I will basically take a little bit inflection, like 3, 4, 5 degrees, then I will just rotate to this side. You see now, I will ask him by myself عشان شوف بس هثبت C2 وهيقدر يتحرك أكثر من اللي هو half range. This is C2. This is very okay. Look على اليمين جهة. You see he's stuck. What I will do, how I will know this the end range. تحت يدك أول ما توصل للإند رينج أنت بتحس إن C2 جاي يعمل لك ريزيستنس شوية لأنه يبغى يلف زيادة. أنت تثبته. يعني تقريبا 45 درجة لسه S2 it's rotating. Sorry, there will be rotation, toward yourself. If you exceed, you will see the C2 start to resist your hand. زيادة عن النورمال. Then I will straight up, ask the patient, to straight up, then you will fix C2. Then you will take a little bit of inflection, it's a passive test. Then I will rotate to where needed. Now we start. If I would like to do further, I could take inside building, I may take, further ranges. I don't need it. And usually when I do this one, I will ask the patient, if you feel any pain, if you feel any dizziness, if you feel any abnormal sensation, just let me know. Again, firm grip on C2, then I will rotate the patient toward me. Now he's stuck. Then I will go to the other side to test the left, I will rotate to the right side. Firm grip here also, then I will go there. Okay guys? Is it clear? I'm not sure. Is it clear? This one it means yes or no? Yes? Okay. This is what we call it آلآم ligament test. Sorry معلش هذا بس آلآم ligament test ما هو sharp burst. هذا آلآم ligament test. طيب بعدين هناخذ اللي هو sharp burst test. sharp burst test هيكون في الاسترس على ايش؟ ايش الليجمنت؟ ترانسفيرس ليجمنت. لان انا هحرك الدنس against transverse ligament. ماشي؟ What I will do in this case, I will fix to the dens C2 لأنه هو ماسك على C2. ماشي يا شباب؟ اوكي؟ هذا C1 هذا C2 كذا زي كذا و C1 هنا. اوكي؟ ماشي؟ الليجمنت هيكون ماسك هو ماسك في C1 لكن ماسك فيرم جريب على الدنس عشان ما ينزل. مش هسوي انا كل السترس هتكون زي كده. لو اي مشكله جامد it will just because I'm pulling the transverse ligament to the disc itself. نفس الشيء هسوي straight up fix grip on C2 little bit of flexion then I will push the head to the posterior side. Okay guys, make a firm grip, little bit flexion, then I will push the head to the posterior side. Is it clear? Firm grip on C2, little bit of flexion, then I will push the head to the posterior side. And then I will ask the patient, do you feel any pain or discomfort in pain? Okay guys, this one is a fit. The movement all from the other hand. Now we know how to test the ALآM ligament and the transverse. The ALآM ligament, firm grip, and rotate to the left and right. For the sharp burst test for the transverse ligament, firm grip in C2, and translate the head to the posterior side. Okay, and when we test it, we will feel it. Then I will test the PPI. Somebody will ask me how you can test the two tests. You can test it from sitting, and you can test it from supine. And the PPI will get compromised with rotation or extension. Usually we test it this way. We ask the patient to straight. If I would like to test the PPI on the left side, I will ask him to rotate the other side. Rotate to this side, to the right side, and hold there for 14 seconds. And ask the patient if you feel any numbness, if you feel any altered vision, if you feel any abnormalities in your face, let me know. 15 seconds, does it feel anything? Then we'll come back to the natural position and hold there for 15 seconds. Why I'm holding? To make the blood flow to rotate back. Hold there for 10 seconds, then I will take him to the other side. And hold for 10 seconds. It's active. It's active. While sitting, it's active. And never mind if it is inactive, I'll just feel compromised. They are this one. In second, if it doesn't feel, means that this is a clear. Somebody they would take it from rotation and extension from supine. And sitting. What they will do rotation. If I would like to test this guy, if you guy in this area, I will take this side and take more extension. Rotation and extension. And then we test the DBI in this area. Okay guys, if you feel numb, blurred vision, tingling sensation in the space in this tongue, this suspect of DBI problem. عرفنا الآن هذا في test يا شباب. This is the upper cervical instability test, and for the PPI, we've got sharp burst test, fixing C2 and translate the head to the posterior side. We've got ALآM ligament, fix grip on C2 and rotate the head passively to left and right. If you feel the sign and symptom come, it means that they're positive. Or if you feel more lax, the patient can move more than half of the range, it means that this is also positive.
Sometimes sometimes difference,
Look, most of the patients with the spondylosis, usually they will feel limited range of motion, and they will feel pain mostly in the morning when they will wake up. And remember that if the PPI here, you want to test it. If you do extension, you compromise the PPI and what? And the facet joint itself is called spondylosis. What about if you just rotate to the other side? You will open the facet joint here, but still you are doing extension. Get my point? ممكن لأنه مستحيل يكون spondylosis for left or right side. They will be both. Compromise one. Away from the side of pain, open the joint here and test. You will see the difference. And remember, with the spondylosis, the patient won't feel dizziness. You won't feel blood vision. You won't feel numbness in his face. All these signs and symptoms that clear-cut signs and symptoms for upper cervical instability or PPI. For spondylosis, it won't come all this stuff. Just forget about it. It's easy. Okay, guys? تبغوا تطبقوا هذا التست بعدين we'll go further. ماشي؟ هنطبق sharp person test على الليجامنت والباسيف physiological movement اللي هو اللي هنتعلمنا البروتراكشن تراكشن، هنتعلم اللي هو الباسيف موفمنت روتيشن، وهنتعلم هذا التست. Then we'll go further. بعد الظهر ان شاء الله هو 12 بريك من الساعه 2 بريك. خلاص 12 خلاص يعني عندنا ثلث ساعه ممكن نطبق هذه التستات السوبر فايز. بعد ان شاء الله بعد الظهر نبدا في المانوال ثيرابي اللي هو في الموبيلايزيشن في البيشن. Okay, now we need a group of look guys, we will have 10 minutes for male and 10 minutes for female. We will use this area. Ladies, you can go for a break or just sort it out or just have a look. We will got 4 minutes for 5 person. After that, the female they will come and practice. Then later on, just we will go for a break and come back for the يلا شباب. يلا اللي جالسين على الراس يلا يلا يلا. 5 هنا 5 على الراس يلا.
لا
كده هتسوي ماشي كده هتختار اللي هو الاكتف والباسيف الباسيف شو الحين هنسوي الباسيف هنسوي
شو الجروب الثاني للجهة الجروب الثاني للجهة
لما تيجي تمشي قدام
عشان حق الذين الرأس لا فعلا
ايوه تاخذ ورك ستيشن اللي فيه البين ده مش
We can use bellow for support. We are using a
أهم شيء هو الشولدر ما يتحرك. لا انت بتسوي موفمنت بس ايه وتسوي سبورت جست سبورت سبورت كثير من المرات سايبين
تمام
حاسبين على الجهة الثانية
مثلا في فلكسبيليتي
تمشي على السلسلة في الملك لازم تشوف ما يستندردايز، لكن اللي نقول نمشي مع سلسلة
معلش على اسم الثانية يكون مثلا في لاكس اللي قبل ويانا نسوي مثلا مانيبيوليشن او حاجه زي كذا ممكن انا اتعدل يعني كوادر بلاي بس على بسبب
ايوه بس يقول لك صح لكن المانيبيوليشن اللي بتسوي هاي فلوس لهم بريتي فلوس
sometimes
ممكن حتى لو انت قلقان من هذا الشيء ممكن تبدا
ليجامنت يعني انا جيت سويت حسيت ان في تحت اليد ترتب نفسك
كيف انت حسيت انه الليجامنت يعني ليش هي
مع الاستابيليتي حقك ترتب لنفسك بحس انه يعني
كيف انت مثلا بناء على ايش هذا
لا مو يعني انا حضرت كورس في الفيستيبولار صحاول واخذنا تستات مادرسه زي كذا وقال يعني احيانا تيجي تشوف ليجامنت زي كذا اذا مثلا بالشكل هذا كانت تقدر يعني
لكن خليني اقول لك مثلا انا باجي لك الجواب الان كيف انت ممكن في ستاندرد احنا مش عارف اللاكسيتي عشان اقول هذا
ما عندي ستاندرد ما عندي ستاندرد
عشان كذا
اللاكسيتي هذا يسمح لك يعني اكسسف موفمنت الاكسسف موفمنت هذا ممكن يسبب لك مشكله في السباينال كورتكس صح ولا لا؟
انا معك لكن انا اقول لك اللي انا اقول لك ما في ستاندرد اللاكسيتي هذا الشيء من المشتري اللي هو البيشنت يعني مثلا قال لك انا السبجكتيف هيستوري واللاكسيتي مثلا او ده ممكن ابدا معاه بالجريدات الاخف يعني شوف الملك ليش في العالم كل 10 مرضى بسوي واحد عارف متى اسوي مانيبيوليشن لما يكون البيشنت عنده ديسكمفورت مور ذان بين يعني مثلا لا بس انا اقول لك شيء السيف
يعني لابد ان اكون في السيف سايد
السيف سايد متى لما انت بتتعامل مع سي 1 سي 3 سي 4 سي 5 سي 6 تي 1
سي 1
سي 1 سي 2 اللي هو اللي فيها الاستابيلتي شويه في بي اي كومبرومايز هذه الاريا خليني اقول لك انا ممكن اسوي سي 0 سي 1 عادي لكن سي 1 او سي 2 فيها روتيشن انا دائما اشتغل فيها موبيلايزيشن ومانيبيوليشن المانيبيوليشن متى بيكون لو كان اند رينج تمام بس لسه في ديسكمفورت انا ممكن لو اخذ على الاند رينج زي كده لف كده بس كليك تريس النهايه لما يكون بس ديسكمفورت لكن حيكون موبيلايزيشن خاصه في سي 1 سي 2 سي 3
ناخذ كيف
لكن شوف لاكس شيء ثاني لاكس ما عندنا ستابلايزيشن هو في لا لكنه البيشنت يشوف ثرو الواتر براكتيشنر عشان يحسب لك هو البيشنت لاكس لكن انا معاك يبدا بالموبيلايزيشن بالنسبه لي عندي مشكله في الموبيلايزيشن يفيك بس ديسكمفورت انا 10 ممكن 10 بيشنت لكن بالنسبه هذا بالنسبه للسي 1 لكن في اللغه
عندنا السلفاكر هذا اللي معروف هذا دائما في السيفيس طيب يعني مثلا السلفاك الرب البيشنت عنده السلفاك نقدر نسوي له مثلا مانيبيوليشن زي مثلا البيشنت عنده
مشكله ما في لانه ما في في بي اي